Good day everyone, my name is Christine Sibayan. I'm a student nurse from Medical College of Northern Philippines. And today, I will be performing a return demonstration on the assessment of the head, the eyes, the nose, mouth, ears, and of course, the neck. So, before we start, I'm going to introduce myself to my patient to verify her identity and of course to explain to her the procedure that I'm about to do. So, prior to the conduct of the procedure, we're going to close the door and the curtains to ensure my patient's privacy and of course perform hand hygiene and wear gloves if necessary. Good morning ma'am, my name is Christine Sibayan, your nurse student for today. May I know your name and your birthday ma'am?
My name is Pinto Saranyas and my birthday is March 1700.
So, age po?
10 po, ma'am.
Before we start, ma'am, ano pong gusto nyo itawag ko sa inyo?
Princess na lang po.
Okay, princess. Bago tayo magsimula, do you want to go to the bathroom?
No po, ma'am.
Do you want to ask me a question?
No po, ma'am.
Okay. So now, I'm going to proceed by assessing the hair and the head of the patient. Pwede ko po bang hawakan yung ulo niya, ma'am?
Opo.
So now, I'm going to observe any scalp in several areas and take notes in any presence of lesions, dandruff, and lice. Pwede ko po bang hawakan yung ulo niya, ma'am?
Opo, ma'am.
Okay. So, as I observed, there is no lice and dandruff or lesions at all. So, the head of the patient is normal. So now, I'm going to palpate the head of the patient by running my pad of fingers to the entire surface. Do you feel anything pain, ma'am? May masakit po ba dito?
Wala po.
Dito?
Wala po.
Dito?
Wala po.
Wala. So, according to the patient, there is no pain. Now, I'm going to assess the face of the patient. Inspect for palpebral tissue. And it seems to be symmetrical. And could you smile for me, ma'am? The nasolabial fold and both left and the right side. So, that means it's normal. Could you close your eyes for me, ma'am? So now, we'll run a cotton over the forehead, the cheek, and jaw of the patient. Do you feel anything, ma'am?
Yes.
And now, we're going to assess the motor function of the patient by doing this. Ma'am, can you clench or chew your jaw? Isa pa po. And now, so ma'am, may papatikin po ako sa inyo. Sabihin niyo lang po sa akin kung nalalasahan niyo po ito. Okay po?
Okay.
Isa pa po. So ma'am, is it sweet, sour, or bitter?
Sweet po.
Okay, sweet. The patient identified the taste and that means it's normal. Could you smile for me, ma'am? Clench your jaw. So, nagawa naman lahat ng pasyente ang lahat ng aking pinagawa. So, that means it's normal po. So now, I'm going to assess the eyebrows of the patient. And it seems to be symmetrical and in line with each other. Pwede ko po bang hawakan yung eyebrows niyo, ma'am?
Opo.
So, the eyebrows, the hair of the eyebrows is in line with each other as well as the eyelashes. And the eyes is symmetrical and in line with each other. So, that means it's normal. Okay, next, we're going to palpate the lacrimal apparatus of the patient. Do you feel anything pain, ma'am? Okay, next, we're going to palpate the nasolacrimal duct of the patient. Eh, dito po may masakit po?
Wala po.
Wala. So, according to the patient, there is no pain at all and there is no tenderness and swelling. So, that means it's normal po. Okay, next, we're going to assess the bulbar and conjunctivae of the patient. Pinita ko dito sa taas, ma'am. So, the conjunctivae of the patient is pinkish in color and there is no foreign object or any type of swelling. So, the patient's conjunctivae is normal. So, now, we're going to assess the scaria and cornea of the patient. Dito. Dito po dito po dito. So, as I observe, there is no abnormalities to the both left and the right side of this cornea and cornea of the patient. So that means it's normal. So now we're going to proceed to the visual acuity of the patient using a Snellen chart. Pwede po ba kayong tumayo, ma'am? Then cover your one eye po and try to read what I'm pointing. Okay po?
Q, C, S, T, O, N.
Wait. Pwede po ba umupo? Upo na po kayo ulit. So now, you just have to follow this pen po without moving your neck. Okay po? So, as I observe, there is no moving at all and shaking po. And so, the findings is normal. So now, we're going to assess the ear of the patient for the size, position, appearance, and skin color. So, as I observe, the ear is in line with each other and the color is perfectly fine as well as the size. And now we're going to palpate the auricle and mastoid of the patient. Do you feel anything pain, ma'am? Dito po? So, as I observed, there is no masses or swelling at all, and according to the patient, there is no pain. Now, we're going to inspect for the ear canal of the patient. So, as I observe, the patient ear canal is fine and there is no foreign object. So, the findings is normal. Now, we're going to assess the nose of the patient. The nose is in the midline and it seems to be symmetrical. Now, we're going to palpate the external nares. Do you feel anything pain, ma'am?
No.
Do you have difficulty in breathing?
None.
Now, we're going to check the olfactory of the patient. Close your eyes. Do you smell this, ma'am?
Yes.
So the patient identified the odor, and that means it's normal. So next, we're going to assess the mouth and lips of the patient. The mouth is symmetrical, both left and right, and the mouth is perfectly fine. And I didn't see any edema or swelling at all, and no bleeding, and that means it's normal. Now we're going to check the temporomandibular of the patient. Say ah.
Ah.
Now we're going to check the gums of the patient. Say ah. So the gums is pinkish in color, and I didn't see any swelling or masses, and that's normal. Now we're going to check the teeth of the patient. Say E. Ah. So the color is the dominant color white, and that means that's normal. Now we're going to check the uvula of the patient. Say ah.
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 So I didn't see any abnormalities, and that means it's normal. So next, we're going to palpate the tongue of the patient. Ah.
Ah.
Wala. Masakit ba?
Hindi po.
So according to the patient, there is no pain at all, and I didn't see any swelling, and that means it's normal. Now, we're going to assess the patient's ability to move her neck by the chin to chest, tip of the head for as possible, each shoulder, and also each ear corresponding to the shoulder. Hindi, baba. Baba. Then, side. Kabila. May naramdaman ko bang pain?
Wala po.
So, according to the patient, there is no pain at all. And when she moved her head, I didn't hear any crack. So, the findings is normal. And next, we're going to inspect and palpate the supraclavicular of the neck by doing this. May masakit ba?
Wala po.
And also, ask the patient if there is any pain or discomfort to identify abnormalities and normal findings. May masakit ba?
Wala po.
So, I observed that there is no pain. According to the patient, there is no pain at all. So now, we're going to proceed for the assessment of the neck. So, we're going to palpate the posterior cervical lymph nodes by doing this. May masakit ba?
Wala po.
Inspect for the frontal and back of the ear as well. May masakit ba?
Wala po.
So, according to the patient, there is no pain. observed that there is no swelling at all. So the findings is normal. And also, if you want to palpate and inspect the under chin of the patient, and also the entire triangle and the neck, and later we're going to palpate and inspect the carotid artery, but one at a time, and also the thyroid gland. So first, we're going to palpate the under chin. May masakit ba?
Wala po.
So next, the anterior triangle. I'm inspecting for masses and there is no swelling at all. May masakit ba?
Wala po.
And there is no pain as well. And next is the carotid. Better used to use stethoscope. And last is the thyroid gland. So, I observed that there is no abnormalities and swelling at all. May naramdaman ka bang pain?
Wala po.
And pain, there is no pain as well. And I didn't see any enlargement. But if you see and feel enlargement, that's considered as a abnormalities. And lastly, we're going to assess the muscle strength of the patient by doing this. Normally, they have an equal strength. So, the normal findings is normal.
Basta tawagan mo.
So, that's how we demonstrate the head and neck assessment. And after we demonstrate all the assessment, we have to perform hand hygiene.